What does that mean by way of even considering mandatory vaccinations for school children?
Well, we cannot mandate vaccination, not just in children but even for adults, no? So hindi po kasama sa ating mga pinag-uusapan at sa direksyon ng ating gobyerno ang gawing mandatory ang pagbabakuna ng COVID-19 vaccine. What we can do is to strongly encourage this vaccination and also to strongly encourage especially those who are really eligible already to get themselves vaccinated. Mag-advocate pa tayo dahil alam naman po natin na ligtas ang mga bakunang to at saka epektibo para po ma-uptake. But never would it be that we will be mandating, no, ito pong pagbabakuna because it's not part of any law in the country.
Ay, ma'am, I'm wondering lang kasi hindi pa may mga mga disease, mga childhood diseases na mandatory yung vaccination. Correct lang if I'm wrong. Parang I do remember may ganun eh. I don't know if it's measles among other diseases.
Yes, sir.
Would it be applicable to?
Yes, we have our immunization law in the country wherein we are really mandating the routine immunization of our children. And this includes vaccines for measles, vaccines for hepatitis B, and the others. But this time around, for COVID-19 vaccines, we cannot mandate this because these are just Emergency Use Authority na mga bakuna. Wala pa po siyang Certificate of Product Registration. So, ibig sabihin, hindi po natin siya pwedeng imandato sa ngayon. This will all be purely voluntary.
But just to be clear about that, the barrier is the classification of the vaccine. In this particular case, EUA pa yan. We don't want to say experimental, no? But basically it's under EUA, hindi pa to like the other drugs na proven na and completely certified. That's the barrier. It's not the law or the constitutional rights or anything of people to refuse it. Am I getting that right?
Well, that's our take, sir, no? So because we still are in that level or phase wherein it's still in the EUA stage. Therefore, we cannot mandate it at this point. Secondly, of course, we would always consider the rights of people kung saan they have that option to take it or not because that is their right, no? So kaya nga po tayo sinasabi, we cannot do it, no? And we cannot say that it can be mandatory. As compared to these vaccines for children that we have had for decades, these are children that the country would like to protect. And these are specific diseases that had been in the country for years already, and we would like to stop these diseases from affecting our children. That's why this immunization law was crafted. Maybe eventually, when these vaccines for COVID have received their certificates of product registration, and when eventually in the coming years, baka po magkaroon tayo ng ganyan direction. But for now, not yet.